Transplant surgery and recovery. The transplant surgery procedure. Your new heart is implanted by a surgeon by doing the following. The pulmonary veins unite as a cuff on the left atrium, which is left intact. The cuff is then attached to the donor heart at the same location. The pulmonary artery and aorta are then attached to the respective donor vessels. The superior and inferior vena cava veins are attached to their respective donor vessels. These details will be described by the surgeon during your consultation as part of your evaluation. The transplant surgery procedure. The following illustrations will help you understand how a donor heart is attached to an organ transplant recipient. The transplant surgery procedure. The surgery takes about 4 to 6 hours, but sometimes longer, based on your medical and surgical history. You will be put to sleep with medications given in your veins by a physician, anesthesiologist, who specializes in these medications and will monitor you throughout the procedure. You will be placed on a heart-lung bypass machine before your surgeon removes your heart. Your chest will be opened by the transplant surgeon in the operating room. The transplant surgery procedure. Your damaged heart will be removed and a new, healthier heart will take its place. You will have an incision down the length of your breastbone or sternum, and your chest will be closed with wires, sutures, and/or staples. Your transplant surgeon will explain the procedure in more detail when you meet in person as part of the transplant evaluation. The transplant surgery procedure, recovery. Occasionally, you may need to return to the operating room due to bleeding or other complications. After the surgery, you will be taken to the intensive care unit for close monitoring, usually for 2 to 3 days before moving to a regular room. If permissible at the time of your transplant, your family can come to see you when you return and can stay at your bedside most of the time, as well as participate in the medical discussions with the team doing rounds every day. The transplant surgery, recovery. When you first wake up, you will have a tube in your throat and you will not be able to speak, but the tube will be removed as soon as you are fully awake and able to take deep breaths on your own. Once the breathing tube is removed and you are strong enough to talk and swallow, you will slowly be allowed to eat and drink and will take your medications by mouth. You will have other tubes as well, for example, chest tubes to drain blood from your chest, a catheter in your neck, and a tube to drain urine from your bladder. The transplant surgery, recovery. There will be several medications given to you in your veins, including pain medication. You will not be pain-free, but we will make the pain bearable, and you will be able to rest. Many patients will not remember most of their early time in the ICU. The nurses will be getting you out of bed to a chair and then walking as soon as you are stable, and will be asking you to do deep breathing exercises in order to prevent a lung infection. The transplant surgery, recovery. Most patients remain in the hospital from 7 to 10 days after heart transplantation, but sometimes longer. You will have a biopsy and an echocardiogram to check the condition of your new heart before you leave the hospital, usually on day 6 or 7 post-transplant. All members of the transplant team will see you and make sure you're ready for discharge and can take care of yourself at home. The transplant surgery, recovery. A transplant coordinator will teach you and your caregiver or caregivers all about your new medications before discharge, purpose of medication, how much and when to take each medication, side effects of the medications. Once you are ready to go home, you will be given a schedule telling you when you have your next appointments and testing at UCLA. The transplant surgery, recovery. Once you're ready to go home, you will be given a schedule telling you when you have your next appointments and testing at UCLA. You will be given instructions about symptoms to call us about that may be signs of surgical complications, organ rejection, or infection. You will be asked to monitor your weight, temperature, heart rate, and blood pressure and record this information for review. The transplant surgery, recovery. You will have frequent clinic visits at first, but these will decrease as you continue to recover from surgery. Sometimes, patients require a longer time to heal and get stronger. You may be transferred to an inpatient rehabilitation facility to complete your recovery for a period of 1 to several weeks. Our transplant team regularly interacts and guides your care at that facility. You will be transported to UCLA either by ambulance or by your family for periodic clinic visits while at the rehabilitation facility. The transplant surgery recovery. For many patients, full recovery takes several months, but you can begin your normal activities such as bathing, dressing, and walking in the first 1 to 2 weeks following surgery. If your recovery is uncomplicated, you can resume more strenuous activities such as lifting more than 10 pounds, exercising, and driving after 6 weeks. Many patients can return to work or travel within 3 to 6 months after surgery, depending on the type of work or travel destination. Your transplant team will collaborate with you and your family to tailor your recovery to your specific situation. Potential risks of transplant surgery. There are potential risks to having heart transplant surgery that you will discuss with your transplant surgeon during your pre-transplant evaluation. Death, failure or rejection of the transplanted heart, requiring additional drugs and possibly mechanical support, such as ECMO or assist device or VAD, or retransplantation. Stroke and/or seizures with potentially permanent brain damage and/or paralysis. Kidney dysfunction or failure requiring long or short-term dialysis. Potential risks of transplant surgery. Bleeding and need for additional surgeries to stop the bleeding. Risk of disease transmission from blood transfusions. Risk of blood clot formation from efforts to stop the bleeding. Risks from general anesthesia. Lung failure, pneumonia, bleeding in the lungs or blood clots in the lungs. Liver dysfunction or failure. Infections in your body and/or poor wound healing or wound infection. Potential risks of transplant surgery. Abnormal heart rhythms that may require a pacemaker. Gastrointestinal complications that may require surgery, blood transfusion, or alternate forms of nutrition. Prolonged time on the breathing machine requiring a tracheostomy incision in your neck and/or chest tubes. Complications from immobility such as severe weakness, pressure sores, pneumonia, and blood clots. Required lifelong anti-rejection medication or immunosuppression medication. Side effects and complications.